Good morning, I'm Janine Morris. I'm here to speak to you about the under-identification of mental health issues and the older person. Just going to share my screen. All right, let's go. Despite being both common and treatable, mental health issues are frequently overlooked in this population, leading to serious consequences. Misconceptions, stigma, and system-level shortcomings contribute significantly to the public health issues and the older person. In this presentation, we'll explore the reasons behind the under-identification and discuss strategies to address depression in the older person. First, let's look at some societal and individual contributors to this problem. At a societal level, ageism plays a significant role. There's a long-standing belief that emotional decline is a natural part of aging. This belief often leads to the dismissal of symptoms such as low mood, fatigue, or withdrawal as normal, rather than signs of mental illness that are treatable. Research has shown that older adults are often excluded from mental health conversations, and many diagnostic models lack age-sensitive frameworks to properly identify depression in this age group. This is problematic because it leaves many older individuals without the care they need. In addition to ageism, stigma is another major barrier. Many older people grew up in a time when mental illness was either hidden or stigmatised. As a result, they are less likely to seek help, disclose their symptoms, or engage in mental health programs. Some may internalise their distress, believing that their suffering is something that they must endure quietly. This fear of judgment and a lack of understanding can be incredibly isolating for older adults experiencing mental health challenges. On the individual level, many older adults avoid discussing emotional difficulties due to a fear of being a burden. They may also believe that nothing can be done to improve their situation. Moreover, symptoms of depression often overlap with signs of physical illness or early cognitive decline, making it more challenging to identify depression without proper assessment. Studies have shown that depression is significantly underdiagnosed in older adults, particularly in those with comorbid physical conditions. This highlights the complexity of diagnosing mental health issues in older adults and the need for more thorough assessments. Even more concerning is the fact that late life suicide, particularly among terminally ill older adults, is sometimes viewed as a rational choice rather than a symptom of undiagnosed depression. This misconception further underscores the need for better recognition and intervention. It's especially critical in settings like residential aged care and palliative care, where mental health support can be life-saving. Despite these challenges, there are evidence-based strategies that can help improve the identification of mental health mental health issues and outcomes for older people. One important strategy is routine mental health screening, using validated screening tools like the Geriatric Depression Scale, the PHQ-9, and the Self-Reporting Questionnaire can help identify depression. These tools have been effective across various cultural contexts and can differentiate between depression and cognitive decline, which are often confused in clinical settings. Regular screening in both primary care and aged care settings can be a game changer in improving mental health outcomes for the older adults. Another essential strategy is healthcare training. Many healthcare providers, particularly in aged care and primary care, need targeted training to detect subtle or atypical symptoms of depression. Misdiagnosis often arises from assumptions that depression symptoms are a normal part of aging or from a lack of knowledge about appropriate screening tools. In hospital settings, time pressures and a lack of mental health knowledge often mean that cognitive decline and mental health go unnoticed. Ensuring healthcare professionals are well equipped to spot mental health issues can make a significant difference. Involving older people in decisions about their care is another key strategy. Shared decision-making has been shown to improve mental health outcomes. Studies have found that when older patients are involved in their care planning, they experience better depression management, When patients feel heard and involved, they are more likely to engage with treatment, adhere to the care plans, and report better well-being. This sense of urgency is crucial in improving their overall quality of life. Family and community engagement is also vital. Research has shown that when families are involved in care, residents in nursing homes report lower levels of depression and better emotional support. In Thailand, a program called the Older Family Network successfully improved mental health and quality of life for older adults through family and community-based care. Community outreach programs can also help connect isolated older adults to support networks and services, which is essential for improving overall mental health and outcomes. Finally, public education and destigmatisation are essential. Public awareness campaigns that challenge outdated beliefs about mental health in older age are needed to shift perceptions. Educating the public and healthcare professionals about the realities of mental health in older adults can help reduce stigma and encourage earlier help-seeking behaviours. Destigmatising conversations about ageing and mental illness will not only promote better mental health, but also improve the quality of the life for the older individuals. To conclude, the under-identification of mental health conditions in older adults is a complex issue rooted in ageism, stigma, diagnostic challenges, and limited awareness. However, even evidence-based strategies like routine screening, staff training, shared decision-making, family involvement, and public education, we can significantly improve mental health outcomes for our older adults. These approaches will not only enhance mental health, but also preserve the dignity and quality of life of the older individual. Addressing these gaps is not just a clinical responsibility, but a societal one. Thank you for your time.